Now I'd like to introduce Dr. Larry Kessler. He's a professor of health services in the School of Public Health in the University of Washington. He will be the moderator for the first Patient Perspectives session.
I'm Larry Kessler, a professor in the Department of Health Services at the University of Washington School of Public Health and Director of Regulatory Oversight for the Center for Dialysis Innovation. I want to thank Jonathan Himmelfarb for opening our conference with his insights into the current landscape and the future of dialysis. Dr. Himmelfarb pointed to the urgent clinical, economic, and public health need to develop new, more efficient, and more effective dialysis technologies. We emphasize the increasingly important roles that patients can play in prioritizing and developing these new technologies. With this in mind, I want to introduce several patients we have spoken to specifically to hear from them about their dialysis experience and what they want to see in the innovation space. Over the past few weeks, I've spoken with Alex Berrios, Yari Cuevas, Amanda Grandinetti, Sharon Rouse, and Caroline Wilkie. Let's hear what they have to say. Thank you.
I'm Yari Cuevas. I'm a 23-year-old dialysis patient. I have a kidney disease since I was born. So I've been dealing with this my whole life. I've had a transplant when I was 11 years old. Well, 10 years old. I was 10. Got my first transplant. Before that, I was in dialysis for 2 years. I've done it all, PD, hemo in center, and right now I'm doing hemo at home.
So my name is Alex Berrios. I'm a 40-year-old man from Louisville, Kentucky. I am a father of 2 children. I have a 9-year-old daughter getting ready to start 4th grade and a 4-year-old son soon to turn 5 next week. I'm a big fan of baseball. I'm a 13-year one-time kidney transplant recipient and now back on dialysis, and am ready to kind of delve into what I think what can happen with dialysis and kind of look at the changes and things of that nature.
Well, my name is Amanda. I'm 30 years old. I am a research methodologist by training. So I received my master's of public health 6 years ago, and I started my career researching clinical practice guidelines in plastic and reconstructive surgery. Also did performance metrics and analyzed registry data and helped some. My workplace actually developed their first registry.
So my name is Sharon Rouse. I live in the Washington, I was born and raised actually in the Washington metropolitan area, right outside in Prince George's County in Fort Washington, Maryland. I'm the oldest of 4. I am a proud wife and mother of 1. And I started my career in education over 20 years ago, first as a classroom teacher, then I moved to be a guidance counselor, then later a resource teacher, and now a coordinator for schools that have a high percentage of students that attend that live in poverty. And so it's been a very rewarding experience working in education, and especially during this difficult time. It's been a joy to really assist families with becoming partners in their children.
So I manage my husband's law firm, and I also manage my sister's photography studio. I really enjoy working with people. I was a teacher for a very long time. I taught special education for 5 years and loved every minute of it. And then was actually going back to school to get my master's in public health when I moved down here and then stopped because I didn't have enough time to do everything.
Some of the challenges I would say with hemo, I think, are and I think I mentioned to you the last time we spoke, in the 13 years I've gone, from having had done dialysis and crashed into it 13 years ago to now back at it now about 6 weeks now. Nothing's really changed in kind of how they provide and how they go about the actual treatment. And I really think that's something that needs to kind of be open and kind of woken a little bit to kind of give us more of a patient-centric voice and kind of have that conversation, have the, having the team there with the nephrologists and the social workers and the dietitians to have that conversation about how can we change dialysis, how can we make it better for the patient.
I was diagnosed with kidney disease when I was 14. It was the summer right before high school. I didn't know what was going on at the time. I was actually on vacation with my family. It was our first family vacation where we took an airplane. We were out of state. And the next day when I woke up, my body had just exploded everywhere with edema. It was absolutely crazy. We went to the ER. I stayed overnight. Didn't really know much of what was going on, but they told me to follow up with a nephrologist or a kidney doctor.
Yeah, so I was diagnosed with kidney disease when I was 2 because I was diagnosed with only having one kidney and then having a bunch of malformations in my bladder and things like that. And so I knew from a young age, probably about the age of 13, that I would either need to go on dialysis or have a transplant. And so I started dialysis when I was 24, 2 months before my 25th birthday. I had a wonderful nephrologist that I finally found. It's really hard when you're a pediatric patient and you see your pediatric doctor for 18 years before they are like, hey, we can't take care of you anymore. And graduating was difficult for me to find somebody that I really liked and trusted and respected. But I did finally find that person.
I would say my first day walking into the dialysis center, I was a young mom in my 30s, I was completely overwhelmed. I didn't know a lot about dialysis. None of my family members have ever been on dialysis that I'm aware of. And so it really, really changed my life walking in there that day. And I just didn't know it went on. You hear a lot about cancer and chemotherapy and what that's like, but you don't hear a lot about dialysis. And so I was completely changed the day I walked in that facility because I didn't know what to expect. And I didn't I kind of understood the process based on the intake that I had from the nurse, but seeing it for yourself was a different experience, and sitting in the chair for myself was a different experience.
Just name some things that you would like to see improved so that we can give that feedback to what we're doing in terms of clinical practice.
I think with PD, there could be, and I've seen some things out there, but I think it could be more mainstream, like with the catheter piece, like the physical part of like being able to not have it just hanging out physically out of your body, like maybe having some kind of like cover or blanket or strap or belt that is like something that could be, not so like obvious to the naked eye. So if you're out traveling, you can just have it, and it can be really subtle, I guess I'm looking for. I don't think that's the word. Or just kind of kind of under wraps.
It's something that I've worked on the past few years, and it's actually my study of focus for my PhD research. And that is patient-reported outcome measures for use in diet. So I would suggest developing patient-reported outcome measures or survey instruments that assess actual patient values that patients prioritize to assess their goals for treatment, not the physician's goals. Like in a hemodialysis chair, and even treatment made me extremely sick where I couldn't do anything else. But beyond hemodialysis, I really wanted to spend time with friends. I had just graduated from college, and because I'm really passionate about research, I really wanted to get a job. But because of all the complications I had from hemodialysis, wasn't able to get a job. I really wanted to live on my own. I wasn't able to live on my own. I had to live with my parents because I couldn't even drive to dialysis because I became just so violently ill after treatment. So working, going to concerts, spending time with friends, and even what probably seems like little things to the average person, being able to work out. I couldn't work out ever because I'd be so winded from dialysis. Having clothes that fit nicely, because you have so much edema and all that, just feeling comfortable. I think those are the things that I prioritize. I think one of the inventions that I would focus on are managing some of the symptoms that inhibit, quality of life and participation in daily activities on dialysis. So, for example, looking at cramping on dialysis, that can really affect an individual's psychology, or when they're at the clinic and they might not, participate in some of the health behaviors that they should be to take care of them.
On dialysis, I think if there could be a way to make it more portable, something maybe a smaller machine, something I could do while I'm traveling in the car or on an airplane, make it more accessible, more easier. Instead of the dialysis machine, create some type of machine or mechanism that would go in your body and recreate the.
I personally don't have a ton of issues cannulating, but I know that is a huge deal for people. It's one of the bigger barriers for home hemodialysis. I mean, I was taught really well, and I can feel it better than anybody else. But having something that would make it easier, even for care partners or people who are doing it solo, to make sure that every time they cannulate, it's the perfect angle, it gets in, and that's actually like some of the second and third world countries. It's such a big deal because the government doesn't pay for those kinds of innovations. So having a machine that could, even work without power, for example, if somebody had a bicycle or, do whatever, and having that available for those types of countries so that those people could actually afford their treatments, or do it at home themselves. I don't know how all of that, the dialysate and stuff would work. Obviously that's, a way far out there dream, but I think that could change, that has the potential to change the world.
Okay, so now let's turn briefly to the things you heard yesterday. What are the things you're excited about and why?
Artificial kidney. It's been one of the things that I'm super excited about. Nobody wants to transplant me because of my history, and because I do so well on dialysis. And I'm very excited about all the vascular stuff that's going on too, with both Buddy Ratner's device, which I think is like super, super really cool. And a lot of people are working on that because I think they realize what a big deal that is, and they're coming at it from all different angles, which I think is really cool because not one solution is going to work for everyone.
I think a more holistic approach needs to happen. There are a lot of moving parts when you're on dialysis, and so, yes, you come to the center, you get the treatment and everything, but as far as some of the physical and social, emotional, and mental concerns that arise as a result of starting the dialysis process, I think having a holistic approach would help a lot of patients, as a huge benefit to patients. In addition, I'm thinking of my peritoneal dialysis experience, and I would imagine even for hemodialysis, home hemodialysis patients, somehow, I would say somehow curtailing that process or minimizing the amount of boxes. I think if there's a way to have a wearable option or some way to insert, I know, they have heart monitors and they have different things like that help people that have heart issues. So if there's an artificial kidney or something that I could wear, sort of like, if someone that has an insulin pump, and they're able to just push the button sometimes and they get that treatment. And I know that you'd have to release the toxins, like once the blood is clean, there has to be a way somehow to release it. So even having some type of, not as much, maybe not as long of a tube as a peritoneal dialysis tube, but some way to get the fluid out. So I know cancer patients have like a port here, and sometimes you're able to put medicine directly into that port. So maybe there's a way to put some type of solution or cleaning solution that would clean the blood out. And then if there's that cord that you could then release the fluid, that would be great to have. I think making it more convenient would really assist families and patients. I also think about elderly patients who aren't able to undergo procedures, maybe to get a cord or things like that. And so having some treatment options, some type of medication maybe.
I love traveling, and I travel internationally, and I travel in the state, well, when we could, before COVID, when we were able to travel freely. I traveled a lot. I've traveled overseas with my machine, and it is a big production and big deal to get everything. We went to Australia and I took 1,500 pounds of supplies with me on the airplane. And granted, it was checked, but even just like a traveling case that had wheels instead of the traveling case they have now, it would be awesome if they could make a smaller, lighter, easier, machine, or a machine that could just plug into anything and make dialysate, that I wouldn't have to take, 24, 25-pound boxes with me.
Like in a hemodialysis chair, and even treatment made me extremely sick where I couldn't do anything else but be on hemodialysis. I really wanted to spend time with friends. I had just graduated from college, and because I'm really passionate about research, I really wanted to get a job. But because of all the complications I had from hemodialysis, wasn't able to get a job. I really wanted to live on my own. I wasn't able to live on my own. I had to live with my parents because I couldn't even drive to dialysis because I became just so violently ill after treatment. So working, going to concerts, spending time with friends, and even what probably seems like little things to the average person, being able to work out. I couldn't work out ever because I'd be so winded from dialysis. Having clothes that fit nicely, because you have so much edema and all that, just feeling comfortable. I think those are the things that I prioritize.